Great. Good afternoon. I'm Shirley Yen, and today I will be talking about presenting some data from a 6-month follow-up study of adolescents who have been hospitalized in an inpatient unit due to suicide risk. And specifically, I'll be addressing the course of suicidal ideation in those participants who met criteria for borderline personality disorder. So what we know about BPD and suicide ideation in adolescents is that BPD indeed does confer additional risk for suicide ideation, and that suicide ideation has a strong relationship to suicide attempt history, particularly in those who engage in an SSI. And we also know that affective reactivity is a core component of BPD. And we also know that suicide crises often emerge from affective distress and affective dysregulation. So the question arises as to whether this reactivity and affect also extends to suicide ideation as well. And specifically, is suicide ideation in those with borderline personality disorder, does it manifest as unstable with multiple fluctuations that can be dramatic, or does it present as more chronic, unremitting, or severe? And furthermore, which type of presentation is associated with higher risk for future suicidal behaviors? So understanding the parameters of suicide ideation is quite important because first of all, suicide ideation is a predictor of subsequent suicidal behavior, though I think the strength of this association that you'll find often varies depending on the sample that's being studied, so that you'll have a stronger signal of this association in community studies or studies that use community samples versus those that might use clinical samples. But nonetheless, I think very importantly, suicide ideation is a central aspect of any suicide risk assessment. All suicide risk assessments entails those questions of, have you been having suicidal thoughts? Yet very little research is focused on parameters of suicide ideation, such as intensity, duration, lability, and none in adolescents to the best of our knowledge. Tracy Whitty and colleagues examined intensity, duration, and variability of suicide ideation in 108 college students who completed the suicide probability scale every day for 4 weeks, and their group found that only high variability of suicide ideation was significantly associated with previous suicide attempt status. And most studies of suicide ideation rely on single administration self-report assessments, which may capture a specific time interval, but they don't necessarily adequately capture the variability within that time interval. So for example, they may ask, how often over the past week have you had thoughts of suicide? Yet clinically, we observe that the course of suicide ideation can be rather heterogeneous. So it can present as quite labile with fluctuations or rather chronic. So in the present study, we're trying to determine what is a pattern of suicide ideation in a high-risk inpatient sample of adolescents with BPD, and how does BPD relate to suicide ideation intensity and lability, and which suicide ideation profile, high intensity or high lability, is associated with a higher risk for suicidal behavior over 6 months of prospective follow-up. And finally, does the assessment of suicide ideation over an interval characterizing chronic intensity or high lability predict better than a one-time self-report assessment? So our participants were recruited from an inpatient psychiatric unit. They were hospitalized due to suicide risk. There were no diagnostic exclusions in our sample. The only rule-outs were cognitive impairments that preclude with completing the baseline assessment or non-English speaking. So we enrolled 118 adolescents, 40% of whom met criteria for borderline personality disorder, and 99 participants provided the full 6 months of follow-up data. The mean age of our sample was 15, predominantly female and Caucasian, though we did have some ethnic and racial diversity as well. We used the KSADS to assess Axis 1 disorders, history of suicidal behaviors, and presence of childhood abuse, and the CIBPD for borderline personality disorder. We also administer the longitudinal interval follow-up evaluation, also known as the LIFE, which was designed to assess the course of Axis 1 disorders. And we used that for that purpose in the study, but we also modified it to assess some of the constructs of particular interest to our study, one of them which was suicide ideation. The LIFE employs a timeline follow look-back methodology that uses memorable time points such as birthdays, important events, school vacations, to assess the course of a particular construct, in this case, suicide ideation. And suicide ideation was assessed at baseline in person, 2 and 4 month follow-up over the phone, and 6 months in person. And weekly ratings were assigned for each week of the 6-month interval. And so suicide ideation was rated on a 6-point scale, such that scores from 4 to 6 correspond to moderate to extreme suicide ideation, and we consider that sort of our clinically significant suicide ideation range. And scores of 1 to 3 corresponded to absent or to minimal suicide ideation. So we operationalized suicide ideation intensity by using the average PSR scores across all follow-up weeks. And we had 2 ways of operationalizing suicide ideation labelity. One was using the mean squared successive differences, which you all heard about in a previous presentation. And here, for us, that captures the degree that the PSR scores change week to week over follow-up. And we also had a count variable, the number of times an adolescent had switched in and out of the clinically significant range. We had several self and caregiver report questionnaires, the SIQ, which assesses suicide ideation, which is a 30-item questionnaire administered to the adolescent. We also administered the AIM, which is 40-item adolescent report, which captures positive affectivity, negative affect intensity, and negative affect reactivity. And a parent administered emotion regulation checklist for them to respond about their child with regard to negative labelity and emotion regulation. And so what you see here is that borderline personality disorder was actually not significantly correlated to SI intensity or SI labelity, nor was it correlated with suicide ideation questionnaire at baseline or 6-month follow-up. However, with regard to suicide attempt history, 80% of those who met criteria for borderline personality disorder reported a suicide attempt at baseline, compared to 50% of those who did not meet criteria for borderline personality disorder. And this was, of course, statistically significant. With regard to our follow-up variables, similarly, there were no significant differences. There was a near significant difference for our main outcome variable, which is suicide events. And what we mean by suicide events is it's a combination of whether they had a suicide attempt or an emergency intervention to intercede in a suicide attempt, so hospitalization or an ER visit due to suicide risk. And here we find that 47% of those with borderline reported a suicide event over follow-up, compared to 28% of those in the without BPD. So here you see that the actual PSR scores were not really different over the follow-up intervals, nor were there any meaningful differences with regard to the number of switches in and out of the clinically significant range. So to address our second question of which of these variables are more highly related to suicide-related outcomes, we found actually that suicide ideation intensity, the weekly mean PSR score, was significantly correlated with both administrations of the SIQ at baseline and follow-up. It was also significantly correlated with suicide attempts over the 6 months follow-up interval, as well as NSSI over 6 months and suicide event over 6 months. However, labelity was not significantly correlated to any of these outcome variables. However, labelity was more correlated with the affective intensity, reactivity, negative labelity variables. So we ran a series of univariate logistic regression models to try to determine, first of all, which of our suicide ideation variables best predicts suicide events at 6-month follow-up. And we found that suicide ideation intensity using the 6 months of PSR data, as well as the SIQ administered at 6 months, were both significant in predicting suicide events outcomes. But we wanted to make sense of some of our discrepant findings, and so we did a post-hoc multivariate analysis as well. So on one hand, we found that borderline personality disorder was not associated with any of our suicide ideation outcome variables. However, it was significantly associated with suicide attempt history, and it was near significant in predicting suicide events at 6 months. So as a better way of trying to understand this seemingly discrepant set of findings, we wanted to look at behavioral dysregulation as well, because, well, one thing we know about the sample based on prior studies is that all the participants were suicidal adolescents. And so affective dysregulation was actually quite high across the board. It was, and so affective dysregulation did not differentiate in our sample those who met criteria for borderline personality disorder and those who didn't. But behavioral dysregulation did, such that those with BPD had both high affective dysregulation and behavioral dysregulation as well. And so in the multivariate model, you see that, not surprisingly, lability in and of itself, the main effect, was not significant in predicting events. Behavioral dysregulation was, and there was a significant trend, near significant findings for the interaction of lability and behavioral dysregulation. So in closing, in a sample of inpatient suicidal adolescents, BPD diagnosis was largely unrelated to SI intensity and SI lability, possibly, in our case, due to restricted severity range. However, BPD was significantly correlated with past history of suicide attempt and near significant differences for follow-up suicide event. And this paradox may be explained by the higher behavioral dysregulation in our BPD sample, which, when combined with lability, has a trend towards predicting suicide events. We found that SI intensity is more clearly associated with prospectively observed suicide attempts and events than lability. In fact, lability was unrelated to other measures of suicide ideation. It was related to negative affect intensity and reactivity, and thus appears to have validity as an SI parameter that's distinct from intensity. We did find that the single time point of SIQ at baseline, the prospective assessment, did not predict SE at 6 months, but weekly SI intensity, which is part prospective, and the SIQ administered at 6 months, which was purely retrospective, performed similarly. And so there were some limitations. Our sample was quite restricted in range. They were all hospitalized adolescents, and I think it's important to examine these questions in broader, more generalizable samples. We relied on retrospective report over 2-month intervals. I think it would be really interesting. We're doing some new work with this to look at daily diary and EMA methods to get finer distinctions in time. And all of our assessments were dependent on self-report, other report, and interview. And I think there's some really promising findings out there with regard to implicit cognitive tasks and physiological data collection through biowatches, biosensors, and such. And so finally, I just want to acknowledge my mentors. My friend, this study was supported by NIMH. I want to thank my collaborators on this, and thank you.